Good morning, chairs, professors, and colleagues. I'm Xingru Tao from Guangzhou Medical University. It's a great honor to present our study, Comparison of Clinical Feature, Strain Genotypes, and Prognosis of Patients with HIV-Positive and HIV-Negative Cryptococcal Meningitis. We have nothing to declare for this study. I will introduce my study following on 5 aspects. Cryptococcal meningitis, CM, mainly affects people with HIV and causes 50% of AIDS-related deaths. HIV-positive and negative patients differ in symptoms, prognosis, and strain genotypes, especially in immune response and drug resistance. In this study, we explored are there differences in clinical features, strain genotypes, and prognosis between HIV-positive and HIV-negative patients with CM. We conducted a retrospective analysis of CM patients hospitalized at Guangzhou AIDS People's Hospital from March 2050 to February 2024. A total of 121 patients were included. 102 were HIV positive and 19 were HIV negative. Here are the key findings. First, in terms of demographics, HIV-positive patients were generally younger and predominantly male. Regarding clinical features, HIV-positive patients were more likely to receive earlier diagnosis and had lower rates of cryptococcal encephalitis. Common symptoms like fever and headache were similar between groups. CD4 counts were significantly lower in HIV-positive patients, as expected. Their CSF inflammatory responses were weaker. On imaging, HIV-positive patients have fewer abnormal CT or MRI findings, especially less hypercephalus and meth lesions. For pathogen identification, among the 102 isolates from HIV-positive patients, 100 were cryptococcal neoformers, 2 were cryptococcal getty, or 19 HIV-negative isolates were cryptococcal neoformers. Genotyping via MLST shows that all isolates belong to the VIN1 genotype. In the HIV-positive group, we identified 3 novel sequence types designed ST685. However, there was no significant difference in genotype distribution between the two groups. For antifungal susceptible, over 18% of isolates in both groups were sensitive to 5-FC, fluconazole, and voriconazole, but only about 16% were sensitive to itraconazole. Interestingly, HIV-positive isolates showed significant higher sensitivity to amphotericin B. As for prognosis, mortality was slightly higher in HIV-positive patients at both week 4 and week 24. However, the difference was not statistically significant. To summarize, consistent with the result of previous studies, although the clinical manifestation of the two groups were generally similar despite different HIV infection status, there were significant differences in immune response and CSF profiles. In the genotype VIN1-ST5 dominate both groups, but the emergence of ST685 underscores the need for continued molecular surveillance, especially in immunosuppressed populations. In closing, I want to sincerely thank the APACC committee for this opportunity. I'm grateful to my mentors and colleagues for their valuable guidance, and to my research team for their dedication. To the patients and families involved, your trust made this work possible. Thank you for your attention.